Hello and welcome to Daily News Simplified, an answer to what, why, and how of newspaper analysis. Today we have taken up important news from The Hindu newspaper Delhi edition dated 20th March 2023. Topics for today's discussion are displayed on your screen. Let's begin the discussion. So the first discussion of today's session is based on this article which featured on page number 6 of The Hindu newspaper. Article titles is Spectre of Stagflation, that means a fear for future that India is going to face the stagflation scenario. Now, stagflation is a composite effect where an economy faces slowdown plus unemployment. Now, according to this article, the analysis by the NSSO in last week has brought out that inflation rate is still hovering around 6.44%, which is well above the upper end of the inflation target, that is 6%. Now further, this article tells that if we will look deeper into the component of the inflation, core inflation is main cause of worry. Now core inflation is inflation calculated without considering the inflation occurred in food and fuel. Now this core inflation has remained up and above 6% for the consecutive third month. Now to contain this inflation, RBI has already raised its benchmark interest rate, that is the lowest interest rate at which money can be lended, by 250 basic points, that is 2.5%. However, it has failed to contain this inflation even though. Now, experts are of opinion that the coming year is going to face El Nino, and with this, India is going to face deficit rainfall and thus lower agricultural produce. Further, which will accentuate into a lower economic growth. Now, when added with the glaring economic challenges that global community is facing, some experts are of opinion that developed countries may face recession also. And now this recession will impact the availability of credit to the market, which will further dampen the consumption and thus again impacting the economy in a negative manner. Now, if you will try to relate it to your GS syllabus, paper 3, Indian economy issues related to planning, mobilization of resources, growth, development and employment has been clearly mentioned. And if you will refer to previous year UPSC question in 2019, UPSC has asked a question based on GDP growth and low inflation. Question reads as that, do you agree with the view that steady GDP growth and low inflation have left the Indian economy in good shape? Give reason in support of your argument. Apart from this topic is also important from the perspective of preliminary examination, as various keywords associated with monetary policy, inflation, deflation, etc. have been a persistent theme of UPSC preliminary examination. As in 2015, it has asked a question based on various facets of inflation in India. As well as in 2020, it has asked a question based on CPI and WPI, which are among the methods used to calculate the inflation. Now try to attempt these questions and let us know your answer in the comment box given below. So here in this discussion, we will be taking up some key terms. We will look into what is inflation and what are its different dimensions, that is aspects. What is inflation targeting? What are the benefits of inflation targeting and challenges associated with it? We will also look into the way forward. So let's begin the discussion. So first we will look into some key terms and try to understand what they mean. So first is inflation. Now, inflation refers to rise in the prices of goods and services of daily or common use, such as food, clothing, housing, recreation, transport, consumer staples, etc. Inflation measures the average price change in a basket of commodities and services over time. Certain commodities are taken into account and the average price change in those commodities are calculated with reference to a base year. Now, based on this calculation, inflation rates are decided. Now, there is a phenomenon which is opposite and rare to that of the inflation, where price index of the same basket falls, and it is known as deflation. Now, inflation is indicative of the decrease in purchasing power of a unit of country's currency, and this is measured as percentage. And how the purchasing power depreciates? Let's understand this with an example. Now, suppose your monthly expenses include 5 different items which cost you around 100 rupees. Now, in very next month, the same 5 items are costing you around 110 rupees. Now, this rise in price might be attributed to rise in price of any of these 5 commodities. So, either you will drop that item from your bucket list, or you are going to spend 10 rupees extra for purchasing the same item so that your basket completes. So, this rise in price disturbs your purchasing power, and the value of your currency, that is in 100 rupees in previous month you were able to buy 5 items, while with the same 100 rupees you are not able to buy the same item. And that is why it is said that currency loses its purchasing power. Now, second term that has been used in article is stagflation. It is a situation characterized by slow economic growth and high unemployment, and it is also accompanied by inflation. Now, next term is skewflation. When inflation, that is general price rise over a sustained period of time, is skewed to one or a small group of community, that situation is termed as skewflation, because inflation is not distributed evenly to every item in the basket, but it is limited to a small group of commodities. Then you will call it a skewflation. Now, galloping inflation is a very high inflation running in the range of double digit or triple digit. That is, as you already know, inflation is calculated in percentage. When inflation reaches to double digit, for example, say 20%, or triple digit, for example, say 200%, then you will call it as a galloping inflation. Now, there is another term that is creeping inflation, which refers to a gradual rise in price levels along time. So, there is no sudden rise in price, but a gradual one. And it is often termed as good for the economy and also called as mild inflation. We will look into this aspect in later part of this discussion. Another inflation is bottleneck inflation, which is also called structural inflation. It occurs when supply falls drastically and the demand remains at the same level. So let us dig deeper into the term inflation. We will look into what are the causes of inflation, what are its effects, who measures it, how it is measured, and what is the difference between headline and core inflation. So first, the causes. Now, in crux, the main causes of inflation in India have been a subject to considerable debates and discussion. However, the main causes can be grouped into two subcategories. One is cost push, another is demand pull. Cost push inflation occurs or caused by rise in prices of factors of production. For example, rise in the cost of raw materials. Now, a spurt in production prices of certain commodities causes inflation as the price of the final product increases. And when this happens, we call it a cost push inflation. Apart from this, increase in prices of goods and services is also a factor to consider, as the involved labor also expects and demands more wages to maintain their cost of living. And this thing spirals into further increase in the prices of goods. So the basic definition is when there is a change, that is rise in the cost of the factors of production, the inflation caused by such phenomena is termed as cost push inflation. Whereas a situation where demand increases due to excess money supply with people without increase in the supply level. Now, for example, if everyone has an extra, that is raised level of money supply, and now everyone wants to buy a same commodity, now they will offer a higher price to have a grab on this commodity. Now this will result into the rise of price of this commodity as the supply remains same. Another example that you can take is the dynamic prices in the railways. When demand rises but supply of ticket remains same. So during festive season, the ticket prices of railways, that is dynamic prices of railways ticket and airline ticket skyrockets. So such situation is called demand pull inflation, because the inflation has been caused due to rise in demand and the same level of supply. So what are the effects of inflation? Now it is also a debatable topic. For some, inflation is beneficial, while for others it is detrimental. For example, if you have invested in a flat, now due to inflation, prices are going up and you are getting a much higher offer for your flat. Now this is a case where inflation has a positive impact on your fortunes. However, the person who is going to buy this flat at the inflated prices may face difficulties. So in general, we already know that the purchasing power of a currency unit decreases as the commodities and services get dearer. That means they get costlier. This also impacts the cost of living in the country. When inflation is high, the cost of living gets higher as well, which ultimately leads to a deceleration in the economic growth. And as we saw that inflation has a different effect on different section of population, inflation is not altogether a bad thing. A certain level of inflation is required, what you learned in creeping inflation, because a certain level of inflation is warranted in the economy to ensure that expenditure is promoted and hoarding money through saving is demotivated. Now the topic like who measures inflation and how it is measured has already covered in DNS dated 11th December 2022. You can refer to this DNS to understand who measures, how it is measured, what is the difference between WPI and CPI, and other aspects related to monetary policy. But we will quickly look into who measures inflation in India. Now there are two kinds of measurement in India. One is CPI and another one is WPI. Now CPI is known as retail inflation, while WPI is known as wholesale inflation. Now CPI is calculated by NSSO under the Ministry of Statistics and Program Implementation, that is MOSPI, while WPI is measured by Office of Economic Advisor under the Ministry of Commerce and Industry. Now how it is measured? The CPI calculates the difference in prices of commodities and services such as food, medical care, education, electronics, etc., which Indian consumers buy for use. On the other hand, the goods and services sold by businesses to small businesses for selling further is captured by WPI, that is Wholesale Price Index. Now another important term that has been used in article and is of importance is difference between headline versus core inflation. Now headline inflation refers to inflation in the CPI or WPI covering all the categories of goods and services. On the other hand, the core inflation excludes the volatile categories such as food and fuel to measure the increase in the prices of goods and services. Hence, a drastic fall in food and fuel prices can bring down the headline inflation by to a large extent. However, the core inflation may remain unaffected because it is excluded from its calculation. So in totality, is inflation is bad for everyone? As we have discussed, inflation is perceived differently by everyone depending upon the kind of assets they possess. For someone with investment in real estate or a stocked commodity, inflation means that their prices of their asset is set for a hike. For those who possess cash, they may be adversely affected by inflation as the value of this cash is depreciating. So you have learned about what is inflation, what are its implications. You also know that the certain level of inflation is a required phenomena for the economy. However, when it crosses a certain level, it becomes unsustainable. So RBI has been entrusted with maintaining that level of inflation. As at the beginning of this discussion, while discussing the article, there is a mention that RBI has raised the benchmark interest rate by 2.5%. By doing this, RBI is pulling out excess money from the market, or RBI is making lending a costly affair. As you have already read that if there is a rise in money supply in the market, with the same level of supply of goods and services, inflation occurs. So this practice of RBI in keeping check on the inflation rate is known as inflation targeting. And this is done through the Monetary Policy Committee, as mentioned in the news also. So under the Reserve Bank of India Act of 1934, which was amended in 2016, RBI is entrusted with the responsibility of conducting monetary policy in India with the primary objective of maintaining price stability while keeping in mind the objective of growth. So let us quickly look into the features of Monetary Policy Committee. Now section 45ZB of the amended RBI Act 1934 provides for an empowered 6-member Monetary Policy Committee to be constituted by the central government by notification in the official gazette. MPC determines the policy repo rate requires to achieve the inflation target. MPC is required to meet at least 4 times in a year. The quorum for the meeting of the MPC is 4 members. That is, at least 4 members should be present. Each member of MPC has 1 vote, and in the event of an equality of vote, the governor has a second or casting vote. Each member of MPC writes a statement specifying the reasons for voting in favor of or against the proposed resolution. So now let us look into what is inflation targeting. It is a monetary policy framework wherein central bank of a country focuses only on maintaining rate of inflation within a target range. In case of India, inflation targeting was introduced through monetary policy framework agreement signed between RBI and Government of India in 2015. As per terms of the agreement, RBI's primary objective would be to maintain price stability while keeping in mind the objective of growth. RBI is required to maintain rate of inflation of 4% with a deviation of 2%, that is plus minus 2%. That is, upper limit is 6% and lower limit is 2%. That is, inflation should not go below this level and should not go up this level. And as we have seen in the news, that core inflation as well as retail inflation has been persistently up and above this target of 6%. So let us look into the benefits of the inflation targeting and the challenges therein. So first is the enhanced transparency. Now explicitly mandated inflation targets bring in more amount of clarity and predictability with respect to rate of inflation and monetary policy formulation. It also promotes growth. And how it promotes growth? Because a high rate of inflation leads to decrease in purchasing power of currency. It reduces savings and investment rates. It increases unemployment and leads to overall decrease in the GDP growth. Further, high rate of inflation is accompanied by higher levels of fiscal and current account deficits, leading to an adverse effect on the macroeconomic stability of the country. Hence, low and moderate level of inflation would incentivize the investors to undertake investment in the economy, leading to promotion of higher growth and development. So, with this clarity and predictability, the growth targets can be achieved in a more prudent manner. Second benefit is autonomy and accountability of RBI. On one hand, RBI has been given complete autonomy in maintaining rate of inflation within mandated targets. On the other hand, it has also set an accountability to RBI. As in, when RBI fails to maintain inflation within the target, then it would be required to submit in writing the reason for its failure. Now, there are some empirical evidences also in favor of inflation targeting. It has been quite successful in some advanced economies such as United Kingdom and New Zealand, etc. These advanced economies have been able to maintain moderate rate of inflation for much longer time, leading to increased macroeconomic stability. So these were the benefits. Let us look into the challenges therein. First is it disregards multifaceted role of the RBI. In a developing country like India, it is not practical for central bank to focus exclusively on inflation without taking into account the larger development developmental context. RBI needs to balance between growth, price stability as well as financial stability. Second challenge is there is no clear link between price stability and financial stability. Now for that, you have to refer to 2008's global financial crisis. Prior to this, advanced economies were able to maintain moderate rate of inflation for a long term, mainly due to adoption of inflation targeting. However, now 2008 global financial crisis has proved that price stability alone cannot lead to financial stability. An excessive focus of central bank on the price stability may lead to neglect of other crucial functions such as regulation, leading to the economic crisis. Now, there are empirical evidences which are against the inflation targeting in India. Because despite stable rate of inflation, Indian economy is facing challenges on multiple fronts. So this targeting is not that much beneficial in the Indian context. Another important reason is poor monetary policy transmission. Now inflation targeting is more suited to developed economies, since monetary policy transmission in such economies is quite efficient. However, in the case of India, monetary policy transmission is quite inefficient, and this can in turn reduces effectiveness of inflation targeting. Another is it hinders GDP growth. To contain inflation, RBI would be required to increase the rate of interest by following contractionary monetary policy. However, such a policy would lead to increase in rate of interest on loans, leading to decrease in investment and consumption expenditure, leading to decline in GDP growth rate, as is the case raised by this very particular article. Another important aspect is that this inflation targeting does not address supply side inflation, because this is required to moderate the prices of such commodities. So what is the way forward? Now, the post-global financial crisis, the dominant view around the world is that of flexible inflation targeting rather than pure inflation targeting, which is more efficient for monetary policy formulation. Now, what is flexible inflation targeting? It says that role of central bank would depend on prevailing rate of inflation in the country. If rate of inflation is way off the target, primary emphasis of the central bank should be bringing the rate of inflation within an acceptable range. However, if the rate of inflation is within the range, central bank should focus on other core objectives. Thus, it is being said that central bank should focus on flexible inflation targeting rather than pure inflation targeting. Thus, there is need for greater debate around kind of inflation targeting that is being practiced in India. Inspiration for our next discussion comes from this article which featured on page number 6 of the Hindu newspaper. Now, in this article, author emphasizes on universal healthcare, that is UHC. And according to author, it must encompass primary, secondary as well as tertiary healthcare for all who need it and at affordable cost without discrimination. Now, healthcare sector and issues related to it has been elaborately covered in DNS session of 4th March 2023 by Vidushi ma'am. You can refer to this DNS session for understanding for healthcare sector. So now in this discussion, we will be examining the specifics of the primary health sector, which is one of the key pillar of the healthcare industry. And we are rightly doing so because the author is also focusing more on the primary healthcare. Now, if you will trace GS Study Paper 2 syllabus, issues relating to development and management of social services relating to health has been mentioned. Tracing the relevance of this topic vis-a-vis UPSC examination, you can see that UPSC has been asking specific questions related to various pillars of healthcare sectors, as in 2020 it has asked a mains question based on field of geriatrics and mental health care. Similarly, in 2018 it has asked a question based on health for all. So here in this discussion we will be taking up what is PHC sector, what constitute PHC sector, what are the challenges, and we will end this discussion with a way forward or suggestion for the same. So let's begin the discussion. Now, before going any further, we must understand what is primary health center, that is PHCs. Now, PHCs are cornerstone of the rural health services. They are the first port of call to a qualified doctor of the public sector in rural areas for the sick and those who directly report or are referred from a subcenter for curative, preventive, and promotive health care. Now, the concept of primary health center is not new to India. The Bhore Committee in 1946 gave the concept of PHC as a basic health unit to provide as close to the people as possible an integrated curative and preventive healthcare to the rural population with emphasis on preventive and promotive aspect of healthcare. Now, the government of India's initiative to create and expand the presence of primary health centers throughout the country is consistent with the 8 elements of primary health care as outlined by the Alma Ata Declaration of 1978. Now, Alma Ata Declaration is a major milestone in the field of public health, and it has identified the primary health care as the key to the attainment of goal of health for all. Now, as we said that India's initiatives are consistent with the 8 elements of primary health care, let us quickly look into them. They are provision of medical care, maternal child health including family planning, safe water supply and basic sanitation, preventive and control of locally endemic diseases, collection and reporting of vital statistics, education about health, national health programs as relevant, referral services, training of health guides, health workers, local DAS and health assistants, and basic laboratory workers. Now, what constitute primary health center? Now, it has two parts. First is the services and second is the providers. Now, services include routine checkups, immunization, screening tests, chronic disease management, referrals to specialists when needed. Whereas service providers include general practitioners, nurse practitioners, midwives, and community health workers. So, the first and foremost important question that should come to your mind should be what is the significance of primary health care? Now, the first is that it promotes preventive care. Now, primary health care helps prevent illness and diseases by promoting healthy living, encouraging vaccination, and providing regular checkups and screenings. So the motto goes with the saying that prevention is better than cure. So it is kind of first point of contact where one can prevent illnesses of grievous character. Second significance lies in increase in accessibility. As most of the primary healthcare centers are close to the places where people live and work. So it becomes often the most accessible form of the healthcare. It is typically delivered in the local clinics or health centers, thus increases the accessibility for all. The third significance lies in the reduction in healthcare cost. Now, early detection and management of illness through primary healthcare can reduce the need for more expensive and specialized care. So, what we have learned in that it promotes preventive care, it's kind of spillover effect which reduces the healthcare costs too. Because at early stages you can identify and cure the illness that you have, which may accentuate and get enlarged into grievous illness, which may cost a person much higher expenditure in terms of treatment and care. Now, another significance lies in the improvement of overall health outcomes. Now, by providing comprehensive and continuous health care, the primary health care centers or primary health care sector can help manage chronic conditions. And it will also result in improvement of overall health outcomes, including a reduced rate of mortality. Now, as you can recall, topic talks about indiscrimination in access to health services. The next significance lies in the same, that it addresses the health inequalities. Now, primary healthcare can help address health inequalities by providing equitable access to healthcare services regardless of income, race, gender, or location. Now, another significance is that it can become the first responder to climate change related threats. Primary healthcare has an important role in responding to climate change related threats to human health, like injuries related to extreme weather events like a storm, fire, floods, infectious disease outbreak due to changing pattern of vector-borne diseases, poor nutrition from reduced food availability because of drought, the psychological impact due to displacement of communities, etc. Now there are some empirical evidences too which strengthen the argument behind strengthening of primary healthcare sector. Now the majority of developed countries federal healthcare budget go towards primary care, including countries like UK, Australia, Canada, Netherlands and Sweden. So as we have discussed the significance, now we know how important is this sector. But still, in India, primary healthcare sector is facing many challenges. Now, what are those challenges? What are those lacuna which are affecting the primary healthcare sector? Now, issues with PHCs are manifold. Now, first is the funding and underinvestment. Now, funding in healthcare sector is quite low itself, leaving insufficient funds for PHCs or the primary healthcare sector. Apart from this, PHCs remain under-equipped and lacking supplies and drugs to provide comprehensive primary care. For example, of the 709 PHCs surveyed in 2009 by the International Institute for Population Science, Mumbai, about 24% did not have an electricity connection and 63% did not have piped water supply. Now, at the same time, PHCs are expected to deliver centrally designed, targeted vertical programs, alienating them further from the communities because this one-size-fits-all theory doesn't work on ground. As a result, even those families that can access PHCs continue to look elsewhere for their critical healthcare needs. Now, another issue is inadequate infrastructure. According to National Health Profile 2019 report, 22% of primary health centers do not have a separate room for immunization and family planning service. Lack of sanitation facility is a significant issue, with around 40% of PHCs not having toilets for patients or staff. And due to this poor infrastructure, many patients in rural areas often have to travel long distances to reach a healthcare facility, and many end up seeking treatment from unqualified practitioners. Now, another issue is shortage of professionals. Now, PHCs are suffering from inadequate skilled and trained manpower. According to Rural Health Statistics 2020-2021, released by the Ministry of Health and Family Welfare, across rural and urban areas, there is 7% shortfall in doctors at primary healthcare center and around 57% dearth of doctors at community health centers. Now, another issue is lack of access to medicine. Now, the high cost of medicine is a significant barrier to healthcare access in India, with many people unable to afford even basic medications. The government's free medicines program, which provide essential medicine to patients for free, has been plagued by shortages and supply chain issues. The lack of access to medicine has led to many patients turning to unlicensed and unregulated pharmacies which may sell substandard or counterfeit drugs. Now, another issue is poor quality of care. A study published by The Lancet found that around 50% of patients in India do not receive the appropriate care for their health conditions. The lack of quality healthcare services is due to a range of factors, including a shortage of qualified healthcare professionals, as we saw here, inadequate infrastructure, as we saw here, and poor regulation of healthcare providers. In addition, many patients in India lack awareness about their health conditions itself, and may not seek timely medical treatment, leading to complications and poor health outcomes. Now, some minor issues include management issues and limited services. Now, management problem is related to poor management abilities, a lack of sufficient training, and supportive supervision of health professionals are problem in PHCs. Whereas PHCs in India provide a limited list of services. And scope is often limited to pregnancy care, child care, and certain services related to national health programs only. So these were the issues. Let us look into what has been done by the government. Now, National Health Policy 2017 commits the government to investing a major proportion that is greater than 2/3 of resources to PHCs. The main mechanism to achieve this are the 1,50,000 health and wellness centers, which are intended to become the main points of contacts for communities within the public health system. These centers will provide comprehensive health care, covering around 70% of outpatient care, including non-communicable diseases and maternal and child health services. These centers will also provide free essential drugs and diagnostic services as well as referral access to secondary and tertiary healthcare. This is part of the government's effort to achieve universal health coverage through its flagship initiative, that is Ayushman Bharat program. Now, having seen the suggestions and government initiative, let us look into some way forward. Now, first is the Srinath Reddy Committee's report. Now, this high-level expert committee on universal health coverage headed by K. Srinath Reddy recommended that expenditure on primary health care should account for at least 70% of all health care expenditures. Now, we can also learn from some good practices in the world. For example, Brazil deployed multidisciplinary family health teams, each of which covers an assigned number of households. Each team comprises a physician, nurse technician, and 4 to 6 community health workers. They are supported by dental hygienists and physiotherapists, apart from connections to psychologists and obstetricians. Between 1994 and 2014, this helped Brazil achieve marked reduction in infant mortality rate, cardiovascular disease mortality, increase in vaccine coverage, and reduction in pediatric and adult hospitalization. Another example is of Ethiopia. Now, introduction of women health extension worker in Ethiopia in 2003 resulted in a 67% reduction in under 5 mortality, 71% reduction in maternal mortality, and 90% reduction in HIV infections, 73% decrease in malaria deaths, and over 50% reduction in TB mortality. Now, these numbers are encouraging and must be learned from and should be replicated in India also. Now, another suggestion is use of telemedicine. Now, telemedicine provides patients remote access to medical consultation and treatments via telecommunication technology. In turn, this contributes to closing the gaps in healthcare access, particularly in rural and remote areas. Telemedicine has proven to be a boon for Indians during the uncertain times of lockdown, and it has the potential to make remote optimized healthcare accessible to every corner of India in future. Now, another important suggestion is health information exchange. Now, HIE systems enable the seamless sharing of patients' health information between various healthcare providers, enhancing care coordination and substantially reducing the medical error. Now, lastly, mobile health is an emerging concept involving the utilization of mobile devices and technology for health services, such as appointment scheduling, remote monitoring, and medication reminder. It can significantly improve patients' access to care and treatment plan adherence. Now, to conclude, government must increase budgetary allocation to healthcare to at least 3 to 4% of the GDP, so that public expenditure on healthcare is at least 70% of total health expenditure. The next topic of discussion is mainly important from the perspective of fodder for your GS answers, as well as some key findings can become basis for formulation of MCQs. This news featured on page number 8 of the Hindu newspaper, that is the text and context section. Now, the National Sample Survey Office, that is NSSO, carried out multiple indicator survey, that is MIS, covering the entire country in its 78th round of survey. The survey was initially planned to be conducted during period of January to December 2020. But the field work was extended till 15th of August 2021 due to the COVID-19 pandemic. So we will briefly look into what were the objectives of the MIS, that is multiple indicator survey, what is the sample design of MIS, and what are its key findings. So let's begin the discussion. Now there are two major objectives of the MIS. First is to collect information for developing estimates of some important sustainable development goals indicator. Now second is to collect information purchase construction of houses, flats by household for residential purpose after 31st March 2014 and information on migration too. Now the sample design included whole of the Indian Union, except for some villages of Andaman and Nicobar Island which were difficult to access. In this survey, two-stage stratified sampling was used, where first stage unit, that is FSU, were village subunits in rural areas, urban frame surveys blocks in urban areas. The FSUs were allocated to states and UTs in proportion to the population as per the census of 2011. Now the second state unit were households in both rural and urban areas. The selection of FSUs, that is first stage unit and second stage unit, were done by simple random sampling without replacement, that is SRS WOR. Now the most important part of this news is its key findings. Now 33.7% of households in India had their principal source of drinking water outside their premises. That means 33.7% of households are still lacking the tap water connection in their houses. 33.8% of households in India use unclean sources such as firewood, chips, crop residue as the primary source of fuel for cooking. Another finding is that around 15,809 adults per lakh were indebted to some institutional, non-institutional agencies. 24.6% of the Indians had the ability to copy a file or folder. Now this reflects the level of digital literacy in India. 35.5% of persons in India had access to piped water in their dwellings. 13.7% of the persons who were willing to move out from their present place of residence in India, the main reason was search for employment. 4.9% of the households in India possessed air conditioners, whereas 5.9% of Indians over 15 years of age had the ability to use basic arithmetic formula in a spreadsheet. Now these were the key findings. Further analysis of this report and its finding will be covered in subsequent DNS. Now there are some news which have been covered recently which you can refer to from the previous editions of DNS, as this article which featured on page number 6 talks about the urban waste management. So if you want to have a clear idea about various aspects of urban waste management, you can refer to DNS dated 28th February 2023. Along with urban waste management, concept of urban mining has also been discussed in this session of DNS. Apart from this, another article relating to India-China border relations has featured on page number 6 of the Hindu newspaper. Now again, this topic has been extensively covered in various DNS sessions. For your reference, you can refer DNS dated 26 December 2022 done by Weber sir to understand the various issues related to India-China relations. That's all for today. Stay tuned for more such updates.